Hey everyone, this is Corine Lafont, your favorite radio host, your only radio host, and favorite girl, of course, broadcasting to you from the lovely island of Trinidad and Tobago in the Caribbean on Between the Lines. And you know how we do it here on Between the Lines, always with gratitude, or as I say, thankfulness. It's a beautiful day. You know, some people have a preference. I prefer the rain, I prefer the sun. Well, we only have two weather conditions here in the Caribbean. So we don't have the four seasons like everyone else. And this is not the hotel I'm talking about. This is the weather, the four seasons. Okay. And so it's a beautiful day for me either way. I'm happy for the rain. I'm happy for the sun. I'm happy either way. I'm just happy to be alive, to be able to witness all of that. So I'm grateful. I'm also grateful to have a beautiful woman next to me. Look at how she's shining. Oh my goodness. Dr. Dr. Rachel, you see I called her wrong? Rachel Wellner.
Thank you.
The Caribbean pronunciation, Rachel.
That's right either way. It's fine. For having me.
So we have a doc in the house, and let me tell you, she's properly qualified. Let me tell you a bit about her. So, Dr. Rachel, my mouth is trying to say Rachel. Dr. Rachel Wellner is a board certified general surgeon. So, don't play with her. She'll cut you up. General surgeon, a fellow of the American College of Surgeons and Society of Surgical Oncology-trained breast oncology surgeon. Wow. Dr. Wellner also earned a master's in public health from Columbia University. Most recently, she founded a startup called Caelum Diagnostic Solutions Incorporated with the goal to identify cancer edges intraoperatively. Now, you see all this kind of medical terms that tie up my tongue and end up on her chair and her bed. I'm not, interoperatively and Caelum Diagnostic.
You were perfect.
Right? Okay. And you know how we do it here in Between the Lines. We showcase the website and everything a little bit later. And I had a peep at her website. Can I tell you, I saw some things there that I need to ask her about, because you're going to be wondering what is going on here. This is a surgeon we're talking about. What's going on this website? Okay. And the topic for today is pretty simple. Pretty simple, people. Hand washing. That's what she said she wanted to talk about. And I want to welcome Rachel, because we're welcoming her in the Caribbean today. Rachel, Dr. Wellner, to Between the Lines.
Thank you so much for that warm welcome, Corine. I really appreciate it.
It's good to have you.
No, you're us. I'm Caribbean in a heartbeat if you would have me.
I have you. I welcome you. Come over. So you're a surgeon. Surgeon. What made you decide to go into? You don't look like a surgeon. Not that I know what a surgeon looks like, but you don't look like a surgeon.
I look like a lot of surgeons look these days. Believe it or not, there are about 50% women going into surgery. So it's changed a lot. It's not the same. It used to be mostly men and the occasional woman going into surgery, but
and they're getting better looking too. They're gorgeous. My goodness.
Yeah, look, I'm over the hill at 46 here, so
hell no, because that makes me ancient, and I ain't ancient.
Okay, no.
I am just 25. I'm just 25, and I'm getting younger every day. Okay,
I'm 25 in my heart too. So. Thank you. And anyway, I went into women's health primarily. I took care of patients with breast cancer and abnormal breast findings that were at risk for breast cancer. So that was the heart of what my clinical practice has been about. And I'm taking a break to found this biotech company, which could be very important for millions and millions of cancer sufferers. So
So why cancer in particular? Why that in particular, and why this particular initiative that you're moving to?
It's a good question. I mean, when I was in medical school and residency, I thought I was going to be a heart surgeon. That was the stuff that I liked.
That would have been good. There are a lot of broken hearts around. That would have been good.
And I went through my breast cancer rotation, and I saw how women my age were suffering from this terrible disease of breast cancer, and my heart just sort of cried. And
Yeah.
that's what I was called to. It called me. I didn't call it,
Yeah.
So I also, I have an extensive humanitarian background. Actually, I've started some medical missions in Nicaragua, Dominican Republic,
Wow.
Guatemala, India. And so being able to deal with breast cancer patients and the complexities that the disease caused, not just for them, but for their family members and friends and everybody involved in the patient's care. It's sort of, I was able to rely upon that, really diving deep into
Hmm.
the patient's problems and what it was going to mean for everything from her job to her standing as a wife or
Wow.
mother, or whatever it is that woman held dear to her, her own very life, watching that possibly come to a halt or radical change.
I,
So
I want to
that's
say something. I want to
Mhm.
say something to you, Dr. Wellner. When I was growing up, as a child, and I'm sure the same for you, to me, cancer was not a topical thing. You never heard the word cancer. People died, old people, you died from old age. Okay? That is what you died from. You just reached an age and you died. And all of a sudden, within the last few years, you're hearing cancer. It's predominant, like waking up and brushing your teeth or eating your favorite meal. It's like a common thing, and it's like if you don't hear it, it's like no, I am wondering, and this is, I mean, a medical question, and then we'll head into the hand washing and your initiative. But I'm interested in knowing what caused this prevalence.
Like what seems like a surge in prevalence.
Yes, why?
Part of it is that it seems like a surge. Part of it is
Mm,
that 20 years ago, 30 years ago, we didn't have great detection modalities, at least in breast,
mm,
also in other types of cancers. We got very, very good with mammography, ultrasonography, even
mhm,
MRI to detect
mhm,
cancer at earlier, more treatable stages. So we are finding it more commonly in
mm,
people. Um, in addition, genetics play a major role. So people with heavy family histories of cancers are always at higher risk. So that's a
mm.
problem.
Yeah.
Age is a major factor. As a woman, you live long enough, you will get a breast cancer. It probably won't
I
kill you.
haven't. Not me.
Probably,
Not my
yeah.
breast. Not.
Right. But in general, that happens with
Yeah.
age.
Mm-hmm.
We're also living a lot longer than we used to. So you're hearing of people getting cancer. Cancer is yes, it is a disease of young people, but it's also a disease of older people. So people are living long
Mm.
enough to have the genes start to tire out. The DNA tires out, makes mutations, which then causes cancer, which produces cells that keep on going and rapidly dividing and not stopping. That's what
No.
cancer.
Tire out. No.
They
No.
don't
No.
have
No.
that's yes, the DNA has a lot of protective mechanisms surrounding it, and those mechanisms do tire out with age. But there are other issues as well. There's the diets, the environment, the pollution levels, and other things that we're probably seeing
Stress.
unprecedented levels of. There's stress levels, um,
Stress.
obesity, alcohol consumption. All these things do increase the risk of developing a cancer. And some of these things are at an all-time high. So you're seeing a dual phenomenon. One is the
Mm.
detection that wasn't we didn't have the tools to detect it before.
Mm-hmm.
We have those tools, and of course some of the genetic and environmental factors that
Mm-hmm.
are around, very, very hard to control. As much as you can tell people, eat a healthy diet, eat organic, eat through
Yeah.
this, that, don't smoke, whatever, there are some obvious ones, but it's very hard to control everything, the
Yeah.
very air that you breathe,
Yeah.
so
Yeah. I remember watching a YouTube video where persons, can't remember what was the video about, but at the end of it, when you watch the comments under the video, one person said the only thing left to eat is bird seed. It was like, it was like, oh my God, the only thing left to eat is bird seed. It's like
right.
the person's like, don't eat it, don't eat that. Don't, like, damn, the only thing left to eat is bird seed. So I mean, you make a choice. You either say, look, chuck it. I'm gonna do what I want to do, enjoy my life, no matter how long it lasts. Or
Right.
because you see people who are very healthy in the gym every day, assumedly being healthy, and they end up dying before you. So You just do
You know,
you.
as
Yeah,
always, you know, it's a personal journey, it's a physical journey, it's a spiritual journey. We don't
yeah,
Nobody has a crystal ball, you know, for how things are going to go. Just
yeah,
use common sense is my
yeah.
advice. You know, try to eat relatively healthy, but enjoy your life as well.
For sure. And now that links back to hand washing, and especially with the pandemic, because our hands, I always told my children, is the one place that picks up a lot of germs, and then we take that and like me, always on the face, or you touch something, it's amazing. If we were to put contact, some sort of thing on our hand, and just track all the places that we touch, involuntarily without knowing, you wouldn't believe the places that you touch and how you come back and touch your own skin. I want you to talk about that and why hand washing is a topic you really wanted to talk about
Sure.
today.
Well, the hands themselves contain exponentials of thousands of colony forming units of bacteria on them.
Ew.
You can tell me what happens to your face when you put your hands on your face, because when I put my hands on my face, I get pimples.
For sure.
Um, you
For sure.
know,
That
and that's
happens to me.
number one causes of even facial acne is you're passing some of that bacteria. Some bacteria is meant to be on the hands. We're never meant to strip our hands completely of the bacteria, but we are meant to reduce some of the harmful bacteria from the hands, which is why hand washing is important. If you've ever been inside a hospital, you'll see a very familiar poster that says hand washing is the number one cause, or lack of hand washing is the number one cause of spreading infection within the hospital. So hand washing is a very important maneuver both inside the hospitals and in the community to help keep the risk of deadly and or less deadly infections low.
Wow. And I mean, even with the COVID, the pandemic, it's this thing that is really spreading it, because they say, sanitize, wash your hands, don't touch your
Right.
face.
Well, we've
Yeah.
proven with COVID that fomite transmission is not really that much of an issue. Whereas, like, if you put your hand on a table that no one's been around, it's not going to necessarily give you COVID. But let's just say someone sneezes and then they, rub it, and then they touch your hand or something like that. That's a different story. So hand washing is very important, Corinne, and I'm all for it, a big believer in it, and people have to know how to do it appropriately, which is what we're coming to in the book.
It's amazing. It's like you have to wash your hands. You watch a TV and they say wash your hands, and like the surgeon where they do the scrub thing and they wash all up here. Do we need to do all of that?
I don't know if it has to be as rough as the scrub that we do in surgery. Sometimes we bleed when we scrub hard and when we scrub the right
Really?
way. Sometimes.
Oh
Although
my God.
actually these days surgeons are not using the old scrub brush technique. We're using the waterless system, just like a Purell. We're using like something called chlorhexidine based solution, and you pump it into your hands, and then you get it up all over here and all your fingertips and all up and around.
Ew.
So
My goodness.
it's important to suds up and to wash for about 20 seconds.
How can you
So
make hand washing fun? I'm thinking, how do I
sure.
make this like a self-care or fun thing? How can I make it fun?
Well, the first thing you can do, here's my shameless pitch, is you can read my book,
Let,
Dr. Who and the Case of Hilda the Hacking Hippo.
hold on. Hold on there, Rachel. Hold on. I'm going to switch to your website while you're doing that. Hold
Okay, go
on.
ahead.
So while you're talking about it, I'm moving around on your website. Hold
Sure,
on. Let me go to the
I will
share.
wait.
Hold on. This is getting more and more exciting. Hold on. Where is your Daria? Yes, Daria. Are you seeing that?
So she's my character, Dr. Roo. Her name
I
is
thought
Dr.
she's pretty
Marcia
cute.
Roo. Yeah, she's pretty cute. She's Marcia because she's a marsupial, which is a specialized mammal that contains a pouch.
That's
And if
right.
you really look at her pouch is magical. So when she gets sent on a mission, her pouch activates kind of like an old doctor's bag, and it contains all the equipment like the stethoscopes and the tongue depressors and the
Which I
reflex
don't
hammer.
like.
All that stuff is inside her pouch.
Why doesn't she have some nice little food in there? Why does it have to be some sort of instruments? I mean, I don't get that. I have to speak to Marsha
She
Roo.
contains snacks. Well, I'll take that into consideration.
Thank you very much. Thank you very much. So, what does Dr. Masharu have to tell us today? Is she
So
expensive? First to begin, is she expensive?
Dr. Rue, I think that she takes, like you just mentioned, she takes food and shelter in exchange for her work.
Okay,
So and
I could deal with that. Yeah, that's doable. Okay.
so so this
She
is the
has
case of
friends.
the hacking hippo named Hilda. So oftentimes, Dr. Wu will get a letter, although we are switching to the digital age. She's going to start getting texts by book 3, but from
Hmm.
her postmaster pal, Louis the Llama. And usually it sends her off to a far away location, a remote location, so the kids get a chance to learn about some landmarks elsewhere in the world. But this one, the second book, she actually stays home. She's been invited to the Sydney Opera House. And she goes to the opera, and there's some beautiful illustrations of the opera house in the book. And Hilda, the hippo, she is hacking. She keeps coughing, and she doesn't know why.
Ew. Is she wearing a
So
mask?
uh, she's wearing a mask
Yeah.
in that situation. Yes, I chose a hippo, by the way, because hippos have very loud voices. If you happened upon a school of hippopotami,
Hmm.
and they're all shouting, their voices reach about 150 decibels, which is the same as a rock concert.
Okay,
So
then.
very
So thank you for telling me that. I know to stay away from them. Thank you.
loud.
Thank you. But her mask,
They also make their own mud. They also
she needs to wear customized mask because I see part of her mouth. What is that? Still,
yeah.
yeah.
Understood. Understood. So in any case, they also make their own mud baths, which is integral to the plot. Because essentially, we're going to find out that Dr. Rue rules out all the other causes of why she's coughing and realizes that Hilda is taking a mud bath and not washing her hands afterwards. So she can't get herself
Damn.
healthy. She's not paying attention to her own hand hygiene. So this book takes you on
Damn.
a fabulous, mysterious journey to teaching you about hand washing and its importance in terms of
Oh,
maintaining health.
and in book one, so we have that was book two. This is book one.
Book
What's
one
happening
was
here?
yeah, that was a journey to teach the kids of Washington D.C. about healthy nutrition. So
Nice.
while the hot dogs and marshmallows go missing from the 4th of July picnic, Dr. Rue spends the entire time teaching her crew about what are healthy replacements for some junkier foods. But she does say there's a little bit of room for fun every once in a while.
I
So
would hope so. I would
she
hope
did
so.
go try to find the hot dogs and the marshmallows and restore them to the picnic.
That would be wise. That would be wise. So this is wonderful. So you have book one and book two. So you authored the books. What made you decide to become a children's author? You're a surgeon, for Christ's sake.
I
What?
am, but I'm a secret writer. I've been a writer my whole life. In college, I majored in Spanish literature, so I used
Are
to
you
write. Uh,
serious?
I used to write papers and term papers in Spanish.
Are you
So I love
serious?
to write. I write novels. I write children's books, and this has been in my head since medical school, since I did my pediatrics rotation, and I finally got up the courage to just go ahead and put my writing out there.
Oh my word! You are just like a whole cornucopia. I can't even say it in one person. It's amazing. I love to see people in the sciences actually show another side. From the arts, a lot of people have this idea that once you're in the sciences, you're also geeky and nerdy. And it's amazing. Yes, and it's amazing the kind of things that people in that era would love to do. And they probably just kept dormant, just like how you did, something that you always wanted to do. And you've decided to do it now. This is amazing. The person who did your illustrations, it's wonderful.
Her name is Irina Dragovna. She's a Ukrainian illustrator. She's absolutely fabulous.
Yes, this is awesome. And I see you have
I have
some
to admit, I don't have the writing gene, the drawing gene, the
fine
illustration.
genes. Well, yes, you have to know your limits, and you stick with what you know. Stick with what you know. You're a surgeon. I mean, that's big enough already. And
I
then
know
you're in
how to cut,
oncology.
but I don't know how to draw.
That's interesting. You know how to cut, but you don't know how to draw. Are you sure you know you're cutting right?
Yeah, I know how to draw the cuts.
What has been the response so far? I see you're having some good responses here about the
Yeah, I
books.
think so far people are really, really enjoying it.
Mm-hmm.
They really are sort of picking up my intention, which was to get engaged in the mystery,
Mm-hmm.
to really fall in love with the characters because they're so adorable, and you just want a little stuffed animal Doctor by your side, which hopefully there will be one day. Um, and and following the mystery down, I use the tool of the differential diagnosis. Like in medicine, you have to rule out this, rule out infection,
Mm-hmm.
rule out this,
Mm-hmm.
rule out a congenital cause, rule out. So
Mm-hmm.
she does a bunch of rule outs until she finds out what the actual cause is. And at the
Mm-hmm.
end, the children and their parents have learned something about basic health. So that's
Awesome.
been sort of the treatment with that, with all the books. And I have a third one coming out soon. But back to the hand washing. So people have asked me, how do you get kids to wash their hands for 20 seconds in a row? And I came up with at least, three ways that I could think of. One was to maybe have a scented
Mm-hmm.
soap. So something that your children like, whether it's vanilla
Bubble
or
gum,
fruit
some
smell,
bubble gummy kind of thing. Yeah.
bubble gum, whatever it is, right? So that they pump it and they have fun sudsing up, and they can sort of laugh and giggle and even read the book while they're washing their hands, or someone can read the book to them.
Yeah.
Another way is to have an action figure or a soap dispenser in one of their favorite characters, and they can take a little bath with your kids.
Yeah.
Um, and a third way was to come up with a song like the alphabet song. I taught my 8-year-old niece how to Vogue. I'm dating myself here. How to Vogue last time I saw her, and we came up with this little "Don't just stand there. Let's get to it. Wash your hands. There's nothing to it."
Hey, hey,
So
hey, let's try that. Let's try that. No, no, hold on. Let's try that. Hold on, hold
okay,
on. We go. Okay, me and you, me and
okay,
you.
ready?
Okay.
Okay. Don't just stand there. Let's get to it. Wash your hands. There's nothing to it. Vogue, vogue, vogue. Not quite 20 seconds, but
So that is the same thing I'm saying. How can we make hand washing fun? And that
those
is
are some
fun.
ways you gotta, as an adult, you gotta get silly with the little ones.
I don't think that will work for the little ones. I think it's more for the adults, Dr. Wellner. I think
Possible. It's
I
possible.
think the adults are going to go more for that, and then the children will be the ones saying, "No, mom, that's not how it's done. That's not how it's done." They're the ones to correct.
It's
But
possible. It's possible.
yeah, it's
So
very possible because
you gotta be
I'm having
crafty.
fun.
You gotta
I'm
be
having
crafty.
fun with it. I'm having fun with it. Oh my goodness. You know what came to me when I saw that? Because when I see children's books or children's authors, when I meet them, I had the idea of a coloring book. Coloring books are coming back. People are loving that. I have my own coloring book here. I have
Oh
my
wow.
pencils, and so yes, yes, it's serious. And so, and so, I think a coloring book would be a great addition to what you're doing if you
Oh, that's
haven't
something
already
I
thought
will
of that.
definitely keep that in mind as something to
Yes,
add to the books. That's a great idea, especially
yes.
having
Please
a
put me in the
companion.
book. Put me in the book as mentioning that to Dr.
Yeah,
Marshall.
I'm going to say, thanks to Corine, we have this special little companion coloring book. And as soon as you finish coloring, you can go wash your hands.
That's in the Vogue style. In the
In the
Vogue
book
style.
style.
I saw you had a lovely, what you call that now? Let me go back to the website. I don't want to miss it. Hold on one second. Oops. What did I do? Hold on. I have to go back to that screen here. You had a trailer. Here we go. You had a little trailer. I want to be able to just show that as we're closing off and then come back to you
Sure.
and do the final. Okay? Let's see if we can do that. Can I expand the screen? screen. I'm not seeing where I could expand it.
I'm not sure that you can. This was another interview.
Oh, this was another interview.
Mm-hmm.
Well, here's what we're going to do. I thought it was a trailer, so I'm going to leave that for persons to watch. I'm going to leave that for persons to watch. I thought it was a trailer of your book. But here's where I want
Another
to
good
get to
idea. You're giving me
persons.
lots of good ideas here.
I am. Yeah, you should have a trailer of your book with the voices of the characters. Well, I'm a publisher, so these are things that I recommend to my clients. So you can have, you can have a trailer with the voices, and so have your own little jingle that persons can, children and parents can follow and sing along, and together with the coloring book. So these are things that I suggest to my clients. So you've gotten free advice from me, and hope that I get a discount from Dr. Marsha.
Fantastic. Thank you so much.
All right. So let me switch back to you here now, and we can round up what we're saying. Let me just close this off. 1 second. Here we go. So it's back to us. So yeah, I thought that was a video trailer that I was going to preview and show to everyone, but it's not. So
okay.
Coming
soon. You're giving me a great idea. I'm going to make it.
Please do, and send it to me, and we can promote and share it. Yeah, that's cute.
Yeah, I have your email. I'll send it to you. Thank you so much.
Yeah. So any final words for the listening audience? Anything that we should know? I know we didn't get to mention about your initiative. If you want to say something about that, you can at this point.
Oh, well, first of all, to wrap up on the book, thank you so much. You can purchase it through the www.drru.health or at Amazon. So that's where you can find it. And there's a third one coming out called Dr. Ru in the Case of the Red Hot Hawaiians about sun care. And that's going to be a good one. So, my initiative about the Caelum Diagnostic Solutions, you mean? We're working on a very high level startup. I've got an excellent team, a top executive team, top management team. We've got some amazing advisors. We're entering into our early proof of concept stage. We will be looking for investors around that time as well. But, we've developed an excellent system to be able to detect cancer while a person's on the table or when they first come to diagnosis, because anyone who's had a biopsy for cancer knows that they usually have to wait several days to a week to get their answers back. And the same thing when they've been on the table, they have to wait several days to a week to find out if it's all come out. So our goal is to make sure it all is detected at the time of either surgery or at biopsy. So
will there ever be a cure for cancer? Will there ever be a cure for cancer at all?
I do believe it will come. I don't know if it's going to be in our lifetimes, but I believe it will come.
Yeah.
I believe it will come. I think we're getting very good with digital information, and we're sort of closing the loop on any misunderstanding gaps. So things are, being produced down. Immunotherapies, individualized tailored therapies. There is a lot going on.
I'll give you my little medical advice as a practicing surgeon myself. So all in my mind, okay? But my belief is, you live a life of happiness. Your cells, this is just my thinking, your cells are actual living beings. Yes, they're living beings.
Yes. They are, and scientifically they are too.
Yeah.
Scientifically, they have their own little batteries.
Of course, they're living little beings in us, and if we keep them happy, they're not going to be doing anything to cause clumping or to cause cancer. That's just my thing. And if you eat well, drink well,
there's a little bit of truth to it. It's not the whole story, but just as we know that stress is bad for our cells, lack of stress and happiness and peace is good for your soul, which is good for your physical as well.
That's right.
But even from a scientific perspective, if we wanted to stay scientific, I mean, in fact, the technology that I'm working with actually looks at the battery within each of our cells. So it actually looks at the energetic properties of each of our cells. So this quantum physics is not just just something that sort of spiritualists talk about. It's really scientific.
It's real. Yeah, it's real. It's real.
but it's not as simple as telling somebody to chill out and they won't get cancer. It's not that simple. I wish it was simple, but it's not as simple as that.
I say move over to the Caribbean, get rid of all the toxicity wherever you're living. Sleep in a hammock, live on the beach, sleep in a hammock, live on the beach. You would never get cancer.
Keep that coconut water coming.
Right from the tree. Right from the tree.
I think I have climbed a tree to get a coconut. Believe it or not. Oh yes, I have.
Oh nice. Oh nice. And I'm sure you have no cancer in your body. See? That's the cure right there.
Yeah, I'm writing children's books, so there's my happy place.
That's right. Keep those cells happy. Keep those cells happy. I remember the movie. I will never forget it. Osmosis Jones. I love that movie. I don't know if you've ever seen it.
I saw it.
That's animation. You need to look it up, Dr. Wellner.
Oh, I will watch it. Absolutely.
Osmosis Jones. And you see all the things happening in the body, in the animation. I was like, woo, this is how we work. This is so awesome. And so I know, just keep the party going, the vibes, inside of the body, all the cells be happy, and you'll be good. You'll be good. You will credit me for this, Dr. Wellner. You will credit me.
I know, Corine. I'll never forget you. I've gotten about 5 very important tips here, so I have to thank you.
That's right. And Masharu needs to remember me, okay?
Absolutely.
It's been a pleasure. It's been fun talking with you. Thank you for sharing about hand washing.
Here.
Yes, and it's the vogue, okay? It's the vogue way of washing hands, all right?
Wash your hands. There's nothing to it. Vogue, vogue, vogue.
Thank you so much, Dr. Rachel Wellner. It's been a pleasure having you on Between the Lines. Keep doing what you're doing. Yes?